Hey, if you're a new grad nurse or even just a nurse looking for some advice, this is for you. Being a new grad is super overwhelming, so I'll keep it simple and just give you a few tips for the start of your successful career. If you already have a specialty in mind, that's amazing. If not, I would definitely recommend doing some kind of nurse residency so you're exposed to maybe different specialties and you can kind of find something there that you really like. I don't necessarily agree that everybody needs to start on a med-surg floor. I think if you have prior medical experience, even being a PCT or receptionist in a unit, anything like that, that kind of exposure is great to have. If you do have your specialty in mind and you're lucky enough to get placed, whether it be the ER, the ICU, L&D, PEDS, or any specialty really, it's important to start studying from day one. And I'm not talking about the studying you do in nursing school, because in reality, the nursing world is completely different. The biggest piece of advice is that you should be learning something new every single day. And you're always going to be learning. You're never going to know everything. So that mentality that you do know everything needs to be kicked right out the door before you even step onto the unit. I definitely advise you getting some books pertaining just to that specialty, even if it's beginning, intermediate, or advanced learning. The reason being is you're going to see things every single day in different levels of acuity, especially in the ER, the ICU. You definitely want to know some foundation for your specialty in order for you to build and be successful. So here's some examples from the ER that I still study now. I bought this book from Amazon actually pretty recently, and it's brand new for like new nurses even, and I still read it. I've been doing it for 6 years. You don't see these medications every single day, right? You're not going to see the same presentation every day from your patients. So even seeing and reading something in here, you'll retain it, especially if it's interesting for you, and it'll help you for when that patient actually does come to your room. You can get a book such as this, or something that pertains to your specialty that's a certification. And the benefit to reading these certification books is almost the same thing as the other one. You're going to see things here, especially in the CEN, that you don't always see, even in your state, in your realm of your job. Spider bites, scorpions, chemical warfare, all of those things are in here. And to me, even though I wasn't seeing it every day, I thought it was so interesting just to at least be able to learn it. Another great tip is take something home with you every day, even if it's one piece of information from a patient that you've never heard of before. You have sources here already that will give you the facts about the condition. Medicine is always evolving, which is why I read every single day. My biggest piece of advice for you, and also for preceptors, please treat your new grads nicely. They don't know everything, and they're there to learn. If you're making them anxious and you're making them upset, they're not going to retain anything. They're going to be in survival mode the entire shift, maybe cry in the bathroom a couple times like I used to do, and probably go home and cry too, like I used to do. Just because you're a new grad does not mean your voice is new. Use it. If you feel like anything during your orientation is hindering you from learning and providing your patients with the best experience, speak up, because that's only going to hurt you. You're very smart, you're set up for success, you passed your boards, and you're going to be great. You just have to utilize the right resources and you'll be amazing.